Hey, what's up guys? My name is Dr. Sammy, and today I'm going to be reviewing the best toothpaste for whitening, preventing cavities, and sensitive teeth. So we're going to be taking a deep dive into toothpaste with or without fluoride, charcoal-based products, and why some toothpaste can actually be very dangerous for your teeth. So let's start with whitening. Whitening toothpaste are incredibly popular, and a lot of these oral health companies insist that by using their whitening toothpaste, you'll be able to dramatically change the shade of your teeth. But it's just not as simple as that. The way that whitening toothpaste works is that it has abrasive agents like silica, which is meant to remove the external stain from the surface of your teeth. I'm talking about stain caused by coffee, tea, red wine, dark colored beverages like sodas, smoking, and things like that. And so if you're drinking a lot of these beverages and you're noticing dark streaks on your teeth, streaks that you can peel off with your fingernail, then whitening toothpaste will work because the abrasive agents will wear away or remove that stain from your teeth. But it's not going to work if your teeth are naturally dark. Rather, you need a bleaching agent like hydrogen peroxide or carbamide peroxide, typically found in whitening trays, that will actually bleach your teeth to a whiter shade. It's important to remember that if you overuse whitening products that have abrasive agents in it like silica or charcoal, that it can actually be damaging to your teeth over the long term. You can wear away the outermost layer of your enamel or the second layer of your tooth called your dentin, and that can cause extreme sensitivity. My advice for people that do drink a lot of tea or coffee or red wine that do have external stain is to use a whitening toothpaste occasionally or intermittently. We don't want it to be our primary toothpaste. Rather, we want to use something that's less abrasive and more protective in order for us to have a healthy smile. So what do we do for people that have really sensitive teeth? So in these cases, I typically recommend a toothpaste that has a desensitizing ingredient in them. And the two of the most popular ingredients are stannous fluoride and potassium nitrate. To make it simple, potassium nitrate desensitizes the nerves within the tooth, and stannous fluoride blocks the microtubules that lead from the external environment to the nerve of the tooth. They work in different ways, and I've had patients that have had a lot of success with one ingredient but not the other. So for those of you that do have sensitive teeth, I would recommend you trying both out, finding out which one works best for you, and then sticking with that type of toothpaste. The one I personally use is Sensodyne Rapid Relief. We are not sponsored by this company, and I actually don't even have it right here, but Sensodyne Pronamel is a very powerful one as well. We also have to remember that these toothpastes are merely meant to help alleviate the symptoms of sensitivity, but we have to understand the underlying cause. You may have gastroesophageal reflux disease, which causes a little bit more acidity in your mouth, which is wearing away your teeth, causing your teeth to be more sensitive. Some people are drinking acidic beverages. Carbonated beverages are really acidic, and if you're drinking that constantly and you have a low pH in your mouth, that's going to wear down your teeth and it's going to cause that sensitivity. So it's not just selecting the appropriate toothpaste, but it's also adhering to really good habits at home so that your teeth can be well maintained, they don't wear down, and hopefully they last you a lifetime. Simply rinsing with water or drinking a lot of water throughout the day is going to help remove a lot of the plaque that adheres to your teeth. It's also going to help control the acidity if you're drinking beverages that are acidic. So what are the best toothpaste to prevent cavities, or the best toothpaste for gingivitis? The most popular ingredient in cavity prevention toothpaste is some type of fluoride. And I know there's a lot of people out there that don't want any fluoride in their toothpaste, and there are alternatives as well, which we'll talk about in just a second. Fluoride basically works by stopping small cavities from getting larger by remineralizing damaged areas of your teeth. It makes your teeth stronger and less likely to get destroyed by the acids that get emitted from the bacteria in your mouth. And it's particularly important for people that don't have the ability to brush their teeth properly. Maybe they have Parkinson's disease. Maybe they're unable to hold the toothbrush and properly brush their teeth in the right way. Or maybe they lack adequate salivary flow. So for these higher risk people, having a lot of fluoride to help make their teeth a little bit stronger is going to be incredibly important. Is it absolutely necessary to have fluoride in your toothpaste in order to keep your teeth clean and healthy? And I would actually argue that no, it's not absolutely necessary. And that people that don't have any cavities in their mouth, people that are doing a good job brushing their teeth, rinsing with water, flossing every day, doing the right technique, and their teeth are perfectly fine and healthy. But unfortunately, a lot of people do not follow great habits, not keeping their teeth clean before they go to sleep, and then they develop all these cavities. And so a lot of the patients that I see that do have a lot of cavities, where they've had root canals, where they've had multiple extractions, they need a little bit extra support to make sure that their teeth are strong to prevent them from losing any more teeth or from preventing them from getting any more cavities in their mouth. And so that's a decision that you ultimately have to make for yourself. Me personally, I did grow up with fluoride and I've been cavity free for a very long time, but it's not just the fluoride use, it's also me taking proper care of my teeth, flossing, brushing every day. So there's that. And with that being said, there are a lot of natural toothpaste on the market with different ingredients. The list goes on and on. There's so many toothpaste out there that have different ingredients that claim to be natural. And ultimately, you have to just make sure that the ingredients are not too abrasive, that they've been tested so that they're not damaging to your mouth. I would go in detail, but I think that maybe it's a little bit redundant to go over every single ingredient and to see whether it's harmful to you or not. I mean, maybe that is something I'll do. Let me know down in the comments below if you do want me to go into specific details over natural-based toothpaste to see what the ingredients do to your body. So what are my final thoughts? What you really need to understand is that our overall mission is to stop the formation of plaque and debris from getting in between our teeth or on the surface of our teeth. If you leave this alone, bacteria will develop, bacteria will secrete an acid, a cavity will form. If the cavity gets big enough, it reaches the nerve, it causes pain. If it's bigger than that, the tooth gets extracted. So we need to stop that process. How do we do that? It's by developing really amazing habits. Brushing our teeth twice a day, flossing in between our teeth, removing that debris. Be a little bit more aware about the foods that you're eating. Be a little bit more proactive about making sure that you're brushing before you go to sleep at night and you're brushing in the morning. My name is Dr. Sammy. I'm wishing you guys the best of health, and I will see you for the next video. Thank you.